Good day to everyone. My name is Reggie de Guzman, and today I'll be discussing lung cancer, also known as bronchogenic carcinoma. This disease remains one of the leading causes of cancer related deaths worldwide, mainly because it is often diagnosed at an advanced stage. My discussion will cover the definition, types, causes, risk factors, clinical manifestations, diagnostics, medical management, and finally nursing management. Let's start with the definition. Lung cancer refers to the uncontrolled growth of abnormal cells in the lungs. These abnormal cells form tumor that can block airways, destroy healthy lung tissue, and spread to the other organs such as the brain, liver, and bones. Essentially, the normal architecture of lungs is destroyed, causing impaired breathing and decreased ability to exchange oxygen and carbon dioxide. There are two major classifications of lung cancer, each with different behaviors and treatment responses. First, we have the non-small cell lung cancer, which represents about 85% of lung cancer cases. This grows more slowly and spread later compared to the small cell lung cancer. Non-small cell lung cancer can also occur both in smokers and non-smokers. This also has more options in treatment, including surgery, targeted therapy, and immunotherapy. Non-small cell lung cancer also has better prognosis when caught early. For the other classification of lung cancer, we have the small cell lung cancer, which represents only 15%, but it is very aggressive. This grows and spreads extremely fast, often widely metastasized at diagnosis, always linked to heavy smoking. Surgery is rarely an option in this type of lung cancer because metastasis is often early. Small cell lung cancer also responds initially to chemotherapy, radiation, but has a poor long-term prognosis. For the etiology of lung cancer, the leading cause of lung cancer remains smoking, which contains over 60 carcinogens that directly damage the lung cells. Other causes include secondhand smoke exposure, carcinogens such as asbestos, radon gas, arsenic, and diesel fumes. We also have genetic mutations and previous lung diseases like tuberculosis and chronic bronchitis. These factors contributes to DNA damage that eventually leads to cancer formation. Here are the risk factors for lung cancer. We have the individuals with higher risk factors. One are smokers, current or former, those exposed to secondhand smoke, workers exposed to asbestos, chemicals, or dust, people living in highly polluted areas, or individuals exposed to radon gas. We also have the older adults, especially over the age of 50, and people with a family history of lung cancer. Understanding these risk factors help identify people who may benefit from early screening. For the clinical manifestations of lung cancer often does not show symptoms in the early stage, which is why many cases are diagnosed late. Common symptoms are persistent cough that doesn't go away, coughing up of blood, shortness of breath or easy fatigability, chest pain, especially when coughing or breathing deeply, hoarseness of voice, unexplained weight loss and loss of appetite. We also have recurrent lung infections such as pneumonia or bronchitis, and lastly, wheezing. But if the cancer has spread or metastasized, these are the following symptoms: bone pain, headache, or seizures. We also have neurologic symptoms when it spreads to the brain, and jaundice when the liver is affected. These symptoms should prompt immediate medical evaluation. For the diagnostic procedure, the diagnosis involves a combination of imaging and laboratory tests to identify which type of cancer cells are present in the lungs. First, we have chest x-ray. This shows a visible mass, shadow, or abnormal area in the lungs that doesn't look like the normal lung tissue. CT scan that shows the exact size, shape and location of the tumor. Sputum cytology. The cancer cells are seen in the sputum sample. Bronchoscopy. The doctor may see a tumor inside the airways or take a tissue sample that shows cancer cells. Biopsy. Cancer cells are found in the tissue under a microscope, confirming the diagnosis. PET scan or positron emission tomography shows areas of high metabolic activity since cancer cells use more sugar and appear bright on the scan. The positive result is a bright or hot spots in the lungs or other organs where the cancer has spread. Lastly, we have bone scan. This is used to check if cancer has spread to the bones or brain. The positive result is a dark or bright areas on the scan which indicates metastasis. I will be adding the result of biopsy. Images are provided for clear visualization of the features of a normal lung and a lung with cancer. For the normal lung, the cell appearance are thin and uniform cells. The structure are clear alveolar spaces. The nuclei are small and regular. The tissue pattern are well organized, and the function of a normal lung is efficient gas exchange. On the other hand, the following are the features of a lung with cancer. For the cell appearance, the cell appears enlarged and irregular. The structure is disorganized and crowded. The nuclei are large, variable, and dark. The tissue pattern are invasive and mass forming, and a lung with cancer functions impaired due to tumor growth. Moving on to our medical management, treatment varies depending on the type, stage, and the patient's condition. One, we have surgery. Under surgery, we have lobectomy. This is the removal of one lobe. Pneumonectomy, the entire lung is removed. And segmentectomy, the smaller lung segments are removed. These procedures are mainly for early stage of non-small cell lung cancer. For number two, we have the radiation therapy. This kills or shrink tumors, used before or after surgery or for symptoms control. For chemotherapy, drugs like cisplatin and carboplatin targets fast-growing cancer cells, while on targeted therapy, drugs like erlotinib works on specific gene mutations. And in immunotherapy, nivolumab helps immune system to attack cancer cells. Lastly, in the medical management, palliative care focuses on comfort, relieves pain, breathing difficulty, and emotional distress. For our nursing management, our nursing diagnosis is ineffective airway clearance related to tumor obstruction, increased secretions, and decreased cough effort, as evidenced by dyspnea, wheezing, and abnormal breath sounds. For our planning, we have a short-term goal and long-term goal. For our short-term goals, at the end of our nursing intervention, our patient will demonstrate effective coughing, breath sounds will improve, and oxygen saturation ranging from 95% to 100%. For our long-term goal, after our nursing interventions, our patients will maintain patent airway, will achieve normal respiratory pattern, and will demonstrate and practice airway clearance techniques. The following are the nursing interventions in order to meet the short-term and long-term goals. We will assess the respiratory rate, pattern, and breath sounds regularly. We will monitor the oxygen saturation for respiratory decline, position the patient in a semi or high Fowlers to improve ventilation, encourage deep breathing and coughing every 2 hours, promote hydration of 2 to 3 liters a day if tolerated. We will administer bronchodilators, mucolytics, or corticosteroids, perform suctioning if needed, give humidified oxygen, encourage smoking cessation, and teach half coughing and per sleep breathing. The rationale of this nursing intervention is to help expand lungs and improve gas exchange, prevents mucus plugging, hydration thins secretions for easier coughing, medications reduce inflammation and opens airways, and education empowers the patient to manage symptoms independently. For the evaluation, after providing the nursing intervention, the patient can effectively expectorate sputum, breath sounds improves, oxygen saturation stabilizes, patients performs proper breathing techniques, and airway remains clear with minimal dyspnea. These pharmacologic management were mentioned in the medical management. These are our chemotherapy drugs, targeted drugs, immunotherapy, and supportive drugs. This sums up my discussion in lung cancer, also known as bronchogenic carcinoma.